then I'd like to thank the petitioners and the Royal College of Nursing Wales and BMA Cymru for bringing forward this important petition. They have spoken with total clarity. Corridor care is not safe, it is not dignified, and it must not continue. Patients in Wales are being treated on trolleys, in chairs and on corridors for hours and sometimes days at a time. Nurses and doctors are forced to provide emergency care without adequate space, privacy or equipment. This isn't world-class care, it's not even acceptable care, and it's certainly not the care people in Wales pay their taxes for and deserve. The BMA and RCN are absolutely right to call for recording and reporting of corridor care and for care in a chair lasting more than 24 hours to be treated as a never event. But that's just a start. We all know that part of the problem lies with delayed discharges and a social care system under immense strain. But we must also acknowledge, we also need acknowledgement, from the Welsh Government that the erosion in the provision of community beds has a huge impact, and in fact it's been catastrophic. Over the past 25 years, North Wales alone has lost around 20% of its hospital beds, most of them community beds, despite demand on those NHS services having risen in those 25 years. Those beds are the pressure valve of the system that people who no longer need acute care can leave hospital safely, freeing up space in our main hospitals. That bridge between hospital and home has been partly demolished, and we are living with the consequences today. Well, that is why I support the work of beds. Bring back community beds. Their message is simple but crucial. Bring back community beds, end tragedies in A&E corridors, decrease patient deaths by reducing ambulance and corridor waits, and senior medics at the door of A&E. And as I've raised many times before, North Wales and my constituency in the Vale of Clwyd desperately need the new Royal Alexandra Community Hospital in Rhyl, built without further delay and with the full number of beds originally promised back in 2013. Anything less will fail to address the scale of need created by years of lost capacity, and I'd like to hear an update on its construction, specifically from the Cabinet Secretary in his response to the debate. The UK Government has set a target to eradicate corridor care in England by 2029. Time will tell whether they succeed, but at least there is a clear ambition, a deadline and a plan on the table. So I ask the Welsh Government directly, will you commit to a target to end corridor care in Wales, set a target and outline exactly how they intend to achieve it? Llywydd, corridor care is not inevitable. It is the result of political decisions, and it can be ended by political will. So I urge members to support this petition. Let's work towards ensuring this, that never again a patient is left languishing in a chair, or in a corridor. And I must just say, as a footnote to, to the debate, I am quite flabbergasted by the hypocrisy of Reform UK, especially when Nigel Farage has previously said that he would want to privatise the NHS, because if it was up to a Reform government, we wouldn't even have a health system that could project the ambitions of this petition in a way that a way would be digestible for the people of Wales. Thank you very much.
Ysgrifennydd the Cabinet.
The Cabinet Secretary for Health and Social Care to contribute to the debate, Jeremy Miles. Thank you, Llywydd.
By